Some New York City school staff could face potential suspension without pay as an immunization mandate kicks in. All teachers and school employees had to receive at least one dose of the COVID-19 vaccine by today. This rule and similar measures across the country come as outbreaks have happened at some schools already this year. Meanwhile, the U.S. has topped 700,000 confirmed COVID-19 deaths since the start of the pandemic. White House Chief Medical Advisor Dr. Anthony Fauci warns more case surges are possible. So Dr. Ron Elfenbein joins us now to talk all things COVID. He's the medical director and owner of FirstCall Medical Center. Once again, thanks for joining us, Dr. Elfenbein. Experts say that the U.S. is turning the corner on the pandemic, but surges are possible with a large portion of the country still not vaccinated against COVID-19. What does the data reveal to you?
Well, good morning. I think it's important to understand that surges will continue. And remember, we're going into respiratory and flu season, which really doesn't portend well for COVID, because flu, colds, respiratory syncytial virus, RSV, all these things sort of mimic COVID symptoms. So we're going to be seeing an uptick in people who are getting sick. And whether it's COVID or flu or something else, we are going into that season. So I certainly expect that we will see more surges. And that's just the natural history, by the way, of pandemics. The volumes go up and then they go down, they go up, they go down. If you look at any pandemic in history, that's exactly what happens. So the light at the end of the tunnel for this particular surge is that for the week, we're down about 30% on hospitalizations and new cases, which is great news, obviously. So that's exciting. But I would caution to say that, we're turning the corner on the pandemic. I think that's kind of a tough thing to say, because, again, we are going to see more surges, and I think that's just inevitable.
So Johnson & Johnson, Dr. Elfenbein, is now expected to seek FDA authorization for booster shots of its COVID-19 vaccine. This comes after a study found the vaccine was only 71% effective against COVID-19 hospitalizations. Doctor, could we see a rise in people demanding a booster shot that differs from the original shot that they received? And also, doctor, if you can just explain, 71% for a lot of people sounds bad, but it's not as bad as it sounds, right? I mean, 71% is still highly effective.
So, Vlad, yes. The internal data from Johnson & Johnson shows that a second Johnson & Johnson shot increases the efficacy of the vaccine to about 94%, which is on par with the two shots from Moderna and Pfizer. Your question is, the second question rather was, could you mix and match, basically, right? I don't want to paraphrase, but I think that's what you were asking me. If you get a Johnson & Johnson shot, could you get a second shot from something else? And I think the answer to that is yes, that does work. We don't really know the data on it yet, and it needs to be studied. And to answer the other question, which I think is the most important, is the 70%, 71%, 75%, whatever that number is, it's still pretty darn good. Remember, what that number really means is that it's reducing your chance of being hospitalized and or dying by that percentage. So when you talk about efficacy of vaccines, it means that if it's 90% efficacious, it means it's reducing your risk of being hospitalized or dying by 90%. Those odds are pretty good. So 70%, 71%, 75%, whatever number you want to quote, and it depends on how you read that data, it's still pretty darn good, yes. And the FDA is meeting October 14th to discuss both the Moderna booster as well as Johnson & Johnson booster. So, yes, I mean, I think that's all good stuff, and hopefully more will come on that as they release the data, and then the FDA looks, very closely at this to decide what they want to do.
Earlier today, Doctor, former FDA Administrator Dr. Scott Gottlieb joined CBSN AM, and we talked about the drug company Merck's new experimental COVID-19 pill that they're asking for approval. They say that it reduces hospitalizations and deaths. I want to play a little bit of what Dr. Gottlieb had to say.
This drug looks very promising. This is probably the most profound treatment effect that I've ever seen from an orally available drug used in the treatment of a respiratory disease. So this is quite a meaningful finding, because the results were in a population of patients who had risk factors for COVID, and they were treated after they developed symptoms, after they developed mild or moderate symptoms of the disease. So they were fairly advanced in the course of their illness, and yet you still saw a very profound treatment effect, a 50% reduction in hospitalization and death.
So I had also asked him about the number of doses available or dosing regimen or whatever. I can't remember the exact phrasing, but it's something like 1.7 million. It's actually not a lot. And so I ask you, your take on the news of this Merck pill, and then how would something like this be administered? Because if there isn't a lot available right now, I presume doctors like you are going to have to pick and choose who would have access to this possibly life-saving medication.
Yes, that is true. Obviously, supply chains being what they are, Merck is a big manufacturer. They can ramp up production, but it's going to take some time. And of course, remember, this has not received FDA authorization yet. But I think we do have great drugs to treat people who are COVID positive in monoclonal antibodies, and there are plenty of them to go around. So I would say that this is very promising, and it's exciting, and it's oral, so it's great because you don't have to get a needle stuck in your arm. But there are other options. So we're not going to be sending people home to die because you're not going to get this drug. There's other drugs we can give you. So I think it's not quite a black and white decision process there. It's not so stark. There's other things that we can do. So this drug is amazing, it looks amazing, and the data looks very, very promising, and it's very, very exciting. But please remember that there are other options that are very, very, very efficacious at keeping people out of the hospital and from dying, and those being monoclonal antibodies, if you're positive or exposed to COVID-19. So this is just another sort of arrow in the quiver that gives us more opportunity to treat people, but it's not the only one.
And finally, Doctor, later this month, an FDA advisory panel will meet to decide if the Pfizer vaccine should get emergency approval for children aged 5 to 11. As you know, this decision could potentially affect more than 28 million kids, with more than 75% of eligible Americans with at least one shot. What could this new pool of people mean, I guess, for herd immunity? And can we expect, I don't know, Doctor, the process by which vaccines get included in the list of vaccines that all children need to be inoculated, all diseases children need to be inoculated against when they start school. Why not just include the COVID vaccine in that list of the mumps and rubella and all those other things that we all received before we got to kindergarten and saw the light of day?
Well, I think that's a good question. I think part of it is that, at least for kids, it's still not an FDA-approved vaccine. Remember, it's only approved now for people and this is only for Pfizer, over the age of 16. Otherwise, they're all FDA authorized, which technically means they're still somewhat experimental. It's not really experimental, but we haven't really given it to kids yet, so to that age group. The other thing that I find very curious about everybody's push to vaccinate is, and trust me, I'm a huge vaxxer. I got vaccinated as soon as I could. I vaccinated my children as soon as it was available for them. But every other infectious disease, as you mentioned, measles, mumps, and rubella, and hepatitis, we measure blood titers, and we say, all right, do you have natural immunity to this? But for some reason, people are losing their jobs, people are getting kicked out of school, people are being marginalized in society because they're not getting vaccinated, but they may have natural immunity to COVID. And why aren't we measuring that? I find it very curious that governmental agencies and companies are not looking to say, do you have natural immunity? If you just had COVID 2 weeks ago, why do you now need to be vaccinated on top of that? And if you do need to be vaccinated, why do you need 2 doses of vaccine? Because there's great data that 1 dose of the vaccine will provide you with long-lasting immunity. So I think this stuff needs to be flushed out before we start mandating across such large populations that everybody get the vaccine. And I'm not minimizing the importance of the vaccine. It is immensely important, and everybody who's eligible should get vaccinated. I'm just raising a point that every other infectious disease we treat differently than COVID. And I find that a little bit curious.
So why is that? That's just really interesting. I didn't realize that. Why does that happen? Why is it happening?
I don't know. I mean, before I can get privileges at any hospital, I need to get blood drawn, and I need to show that my MMR titer is sufficient and my hepatitis B titer is sufficient. So why shouldn't we look at the COVID-19 titer and say, you know what, this person has a valid COVID-19 titer, and maybe it needs to be repeated every 3 months or every 4 months, because we know that immunity will wane over time. But everybody's pushed to vaccinate. There are side effects to the vaccine, and if you have natural immunity, and we all know that nature always wins over man. So, natural immunity is better than vaccine-induced immunity. So why aren't we just measuring people's titers? Why are we firing people, especially during a pandemic? I don't understand why New York State is laying off all these healthcare workers, some of whom may have natural immunity to it. I mean, we are in the middle of a global pandemic, so why are we firing healthcare workers? I just find that very curious.
I think that's a really interesting observation, Doctor. And I think it's a little bit, it seems like kind of part of a theme in terms of the approach to the pandemic, not just when it comes to vaccinations, but also, definitely early on implementing restrictions, that maybe it's an attempt to simplify the message, that sometimes it becomes a one-size-fits-all directive. When we've seen, that this is a pandemic that has hit different communities in different ways. And perhaps, what you're talking about is a more customized approach to the vaccination or to restrictions, because at the end of the day, every decision we make, there's a ripple effect, whether it's going to have an economic ripple effect, or whether or not you're going to be down for a couple of days because you got an additional dose of a vaccine that really wasn't necessary. That perhaps in the attempt to simplify the message, we've lost the customized way of approaching this. I don't know if that makes any sense.
That's a great point. But remember that this is not without consequence. I mean, people do get myocarditis from the vaccine. People do get Guillain-Barré from the vaccine. So, not everybody who's choosing to not get vaccinated is a crazy, anti-vaxxer. There are other people have various reasons. Your point is very valid, Emery. I think it's a good one that, we're trying to simplify the message and get everybody back to life and the normalcy as possible. But, Nature just came out with an article that said over 100 million Americans have had COVID. And if you add that to the 185 million Americans who've been vaccinated, fully vaccinated, that's 87% of our population that has either had COVID or has been vaccinated. Well, everybody has estimated a herd immunity is between 70 and 90%. So we're pretty much there. So it's just, why are we not looking at this? And we all talk about following the science, but that is the science. The science is we know natural immunity works. So why aren't we looking at people's natural immunity? It's just very curious. And I don't know the answers to this.
Yeah, these are fascinating observations, Doctor. And I wonder, is it possible for doctors to test someone before they receive the vaccine to find out if they will have one of these adverse effects to the vaccine?
Unfortunately, no. That's a great question. And that would be wonderful if we could identify some risk factors that would make people at higher risk for having these problems after the vaccine. I mean, they did identify a few with Johnson & Johnson for the blood clots, but for the other two, no, there's really, as far as I know, there's no predisposing things that make you higher risk for having an adverse reaction.
Really fascinating discussion as always. Dr. Ron Elfenbein, thank you very much.
Thank you, guys.